are absolutely excited to be back for another week of Women's Health Weekly. I'd like to introduce my longtime colleague, Dr. Nikole Ostrov. Dr. Ostrov was the very first doctor to join me in Maiden Lane Medical. So what are we talking about today, just in general?
Birth control, contraception.
All right, contraception. Who even needs contraception?
You know, what most people think of as birth control is just that in the name, is birth control, prevention of pregnancy. So certainly women of reproductive age, and that runs from your teen years all the way up until menopause, there is a chance you could get pregnant. And so women that are trying to prevent pregnancy, of course, that's the number one reason why you think of birth control and contraception. So that's going to be number one. But of course, there are many other benefits, which I'm sure many women out there can attest to, for their birth control or their contraception. So it's not always just for prevention of pregnancy. It can be to help other symptoms that you have, whether it's symptoms of acne, whether it's the mood symptoms that you might get, or your premenstrual symptoms before you get your period. If you have terrible periods that they're crampy, they're heavy, they're irregular, women that just really want some control over their periods. You know, I have a ton of patients that are athletes and really want to know exactly when they're going to get their period, or don't want a period at all. And that's actually okay when you're using birth control. You know, there's much different clinical relevance of not getting a period versus not getting a bleed on birth control. And so some women just want it also for that menstrual control. So many different reasons for contraception.
What are the different types of birth control pills broadly out there that patients can use?
The birth control pill is definitely still the most common form birth control method used here in the United States. There's some other methods that are creeping up there, but nothing that's coming close yet to pills. It's hormonal. So when we talk about birth control, there's hormonal methods and then there's non-hormonal methods. This is a hormonal form of contraception. Most birth control pills are made up of two hormones, estrogen and progesterone. There is a particular pill that is progesterone only for that woman that for any number of reasons cannot take estrogen, which we, you know, that's why we take a good history on our patients, because there are some women that should not be on estrogen containing birth control. And so there is a progesterone pill as well. But in general, it's a pill. You swallow it. There are some chewable ones, but there are some women that can't swallow pills. It's something that you have to swallow. It's something that you have to remember to take every single day. And in general, it helps with your menstrual cycles. It gives you a nice regular bleed. They can help with acne. They can help with mood symptoms before your period. They can help with the heaviness of a period and the number of days of bleeding. The other thing to note is it's controllable. You know, I have a lot of women that we decide to skip their periods altogether. They're swimmers, they're getting married, for any number of reasons. It's actually easy to manipulate your own period on a birth control pill by skipping the last week of pills, which are hormone-free. So there's a little bit of wiggle room there as far as that 28-day bleed as well.
When I'm bleeding, not me personally, because I don't take birth control pills and also don't have menstrual cycles. But if I were asking as a patient, I might ask the question, when I'm bleeding, is that an actual period? What is that?
You know, for conversation purposes, you come into the office, and even if you're on a birth control pill, we say, when was your most recent period? But these aren't real periods. These are fake bleeds. They're fake in the sense that your own menstrual cycle is getting completely wiped out with this birth control. And you can think of it, the birth control pill is kind of taking over that menstrual cycle. So what's happening is you're taking these hormones, and the inner lining of your uterus, that's the lining that builds up and sheds every single month with your period. That's the lining is where a baby would implant itself. That's the tissue that is shedding every month. And what's happening, you know, for layman's sake, is that with a birth control pill, those pills you're taking in those first 21 days, those first 3 weeks, it's keeping that lining very, very thin. So what would normally build up and there's a lot to shed, it's really just kind of doing like this. And so there's really not much there to come out, hence a shorter, lighter bleed on a birth control pill, and sometimes no bleed at all. So these aren't real periods. They're what we call withdrawal bleeds, but it sounds kind of funny to come to the office and ask a patient, when was your most recent withdrawal bleed? They're going to look at us like we have three heads.
Yeah, right.
So we say periods, but these are not periods at all.
I've heard these terms thrown around. Monophasic, biphasic, triphasic. Is there a difference between any of those, and does it matter?
All that means mono, di, tri, 1, 2, 3. It's basically the change in the dose of the hormones, of the makeup of that pill in your pill pack. And so I tend to usually prescribe monophasic pills. I think there is something to say for keeping women kind of more even keeled of taking the same dose throughout the entire pill pack. You know, a lot of women have heard of the birth control pill orthotricycline. You know, that happens to be a triphasic birth control pill. And if they look at their pill pack, they'll see that there's many different colors of the pills in the pill pack. And that's just a change in the hormones. And it was really, you know, they're made to kind of try to mimic a normal menstrual cycle. Our hormones go up and down throughout our normal menstrual cycle. And so some of these we're trying to mimic that a little bit, but I actually do find, as far as some side effects, that some women experience a little bit more side effects the more we change the dose of hormones throughout the pill pack. So I'm usually inclined, especially when starting a woman on a first pill, to keep you on a monophasic, the same dose throughout the entire pill pack.